We support the implementation of evidence to date in a number of ways. We have got some very good, very strong evidence-based programs such as Family Nurse Partnership, which is a 30-year evidence base from the US. So it was important for us to look at programs such as that, and also ones called Psychology of Parenting, which are the Triple P and Incredible Years. Both of those programs have very strong evidence base, as does the Family Nurse Partnership program. One of the key things that we're trying to do with Family Nurse Partnership is to make sure that it fits with existing programs, and obviously health visitors are critically important to the delivery of early years programs. So we try and make sure that the evidence-based programs such as Family Nurse Partnership fit very well with existing universal services. One of the other evidence-based programs is Child Smile, which has been very successful in Scotland. We know there's a lot of evidence to say that toothbrushing and what are called fluoride varnishes in young children are very effective in preventing dental decay. So the Child Smile program was implemented here, and it has been very successful in reducing the amount of dental decay in young children. And of course, not only does that save money, but more importantly, it saves a lot of grief and pain for young children going to dentists, having procedures done, and those are being avoided. And so that's a great improvement for Scotland's children. We work very closely right across the Scottish Government, and obviously with the likes of the Early Years Collaborative. The Early Years Collaborative, for instance, is funding the 2 Psychology of Parenting programs across Scotland at the moment. And we work very closely with the Early Years Collaborative, with our colleagues in education, with the Getting It Right for Every Child team. And my directorate is the only one in the Scottish Government that reports to 3 sets of ministers. So the Children and Families Directorate is truly integrated across the whole of government. So we make sure that we work together on these programs. So we align all of these programs so that we can implement the evidence and work with the evidence. But also the Early Years Collaborative is working with colleagues on the ground, folks out there in the front line, to do improvement methodology as well, so to improve the way in which they do early years work. So there's a lot of work going on with that as well, and we're very aware of it. And some of my policy areas, for instance, the 27 to 30 month review, maternity care that I deal with, are also being taken forward by the Early Years Collaborative. So work is going on across the government in collaboration to try and get effective interventions across Scotland on all of these policy areas. In terms of the kinds of implementation or implementing the kind of programs that we've spoken about, one of the things that makes them work is that they have to be implemented with fidelity, so faithfully to the way in which the research says they were effective. So the important bit is to make sure that practitioners are aware that if they're doing evidence-based things, they need to implement them as per the program, and you can't change them, because if you change them, then you have difficulty in knowing whether they're still effective. So part of the importance of this is that practitioners understand how to do evidence-based programs and how to implement them in a way that preserves their effectiveness. So that's one of the critical aspects of evidence-based programs.
In any interventions that we think about putting in place, we need to think about the centrality of good relationships. That's good relationships between staff and parents, between staff, and also between parents and children, because actually it's those connected relationships that actually make a difference to parents and to children in terms of how we do our work. I think as we take this work forward, I would want to look at how we work with the strengths of parents. And in order to do that, we actually need to skill up our workforce so that they're very clear about working with parents and their strengths. Our workforce will need to identify what their own strengths are and be able to use them. And that means that we will need to support our workforce in quite a different way to build the capacity that we need to take this whole agenda forward in Scotland.